Hi, this is Dr. Sally Foote, and this is Simone, yes, and she's here for her annual wellness exam. We thought we'd take this opportunity to show you some handling techniques for cats during their wellness exams, and also to help learn a little bit about reading their body language as we go along in the exam to tell if they're happy or not happy, getting stressed or not. So basically, this is Simone. She's a female domestic short hair, about 2-3 years old?
About 5.
Oh, sorry, about 5 years old. And as you can see, she is pretty calm and relaxed while she's up in Debbie's arms. Her ears are forward. She's not fighting or struggling. And she's actually purring. And so we'll get started with her exam. But the main point is that there really isn't any need right now, while we may want to get Simone down on the table, right now there isn't any need to have to scruff her or hold her real firmly as we're going along in this exam. Now for cats, we do like to try to find what rewards them. Some cats like the liver paste. This is made by Kong, and we preload it into 3cc syringes. So we can say, Simone, are you interested? And put a little bit on the table. There you go. Maybe yes, maybe no. Other things you can try. A lot of cats are not that food motivated, no matter how hungry they are. But some cats will like, say, the Sweet Temptations or other dry, cat treats. All right. Hi, Simone. So typically what I do is I give the cat a few minutes to get acclimated to the room, get acclimated to our... Hi. Back again. So we are now continuing on with Simone's exam. And as you can see, some things that clearly tell us that Simone is feeling pretty decent and good is, of course, she wants to investigate, and that's normal for a cat. And giving them a little bit of freedom to investigate is very helpful. She wants to headbutt my technician here, Debbie, rubbing up against her, which is the facial marking that cats do as a way to say, you belong to me, I like you. In other words, think of like the kitty handshake. So if you've got that cat rubbing up against you, that's a good thing. They're not necessarily pushing on you to get you to go away. That's a cat's way of saying, I'm really glad to see you and I like you. So, we're going to check her temperature now, and as we do some of these things, we're going to use a lot of distracting techniques rather than firm holding. So I'm going to go ahead and put the ear thermometer in, and Debbie's rubbing her back in, what she likes. Oh, very good. And we got the temperature here, and Debbie continues on rubbing her head as a reward. She seems to like physical praise here. She did eat some of her dry treats, but we can combine physical praise or a physical reward along with some food rewards. And as I go on in the exam, again here we are a little squirrely, but not too bad. We're feeling your abdomen. Sometimes we'll put a towel on the table so they feel a little more comfortable and not sliding around. Simone's pretty active, and I think she's usually slid off the towel when we put it on there before. Classic curve of the tail. This is a interested cat. Cat is feeling good. That up and down kind of curve is a good one. Good girl. Don't see any fleas. Great. Okay. Now to examine her mouth. I will look in the mouth. If she was really difficult, we may use a tongue depressor. So come here, honey. Now, when we look in the mouth, we want to just lift the lip. Don't start yanking the mouth open. Lift the lip a bit and the lower teeth. Good kitty. If she was really struggling, we could take the tongue depressor and just on the side get her to open her teeth like that. Very good. Just using that as something to open up. And again, she gets either reward, give her a little break. So this way we're not having her get tense and escalate up. Okay. We have palpate her abdomen. For this again, we have Debbie keeping her busy up at the front half with rubbing and petting. While her ears are a little bit down right now, as you can see, it's her way of saying, what you doing? But she's not growling, she's not turning her head, and she's not tensing her body. All that is just saying, I'm okay with this. And that's fine. That's really pretty good for a cat. So, you can stop.